Okay, here we go. Yay! I'm hoping that everybody can see this. I'm going to go on that because I now no longer can see you. As I mentioned in the beginning, what I'll do is I'll stop the recording at the end, and if anyone has any specific questions, I will answer to the best of my ability. But just as a note with regards to this, when it comes to answering specific questions about specific health concerns, I'm going to bow out of that and just keep them general at best, just because as a healthcare practitioner, I just have to be mindful of that. So anyways, just as my 2 cents with that. But okay, welcome. Holistic Health Options for Kids. My name is Dr. Andrea Ryan. A little bit about myself. I was a chiropractor for 15 years. I worked alongside my husband. Actually, he and I are both chiropractors for the last 10 years. And what we did was started to really focus. We worked in the States in the beginning, and then we really started to focus on family health. We started to focus on building our own business. When we moved up to Canada, we purchased the chiropractic practice that used to be my stepmom's, and really just focused on family health and bringing in the awareness when it came to full health on a much broader spectrum. For us, it was not just about delivering chiropractic care. It was about teaching families and our patients about nutrition and about exercise and the importance of sleep and how stress affects things. So we really kind of made it a full focused practice in that respect. We were a family-run, family-focused practice. I brought doTERRA into the practice maybe about 3.5 years ago. And just over 1.5 years ago, I stepped back from chiropractic practice, to focus full-time on doTERRA. So I have been an essential oils educator with doTERRA as well for the last 4 and a bit years, full-time on that for the last 1.5 years. All of my undergraduate work was in nutrition before I went into chiropractic. And I'm a mom to 3 kids. Our kids are 12, 9, and 6. So we've been sort of doing this parenting gig now for a bit, always learning, always experiencing. But what I want to draw upon with regards to this seminar or this workshop is not just my experience in healthcare, but also with regards to being a mom. Because what I think is the key component here is that regardless of what I saw in practice, when I would have any parent that just said something doesn't feel right, it just that my child isn't who they are, they're not acting the way they normally do, or I can tell they're in pain, I can tell something is going on more than what's being presented here, that was the biggest red flag for me. So if I saw a parent that was sort of just had that gut feeling that was off, I knew that that was something we needed to tap into and learn more about. So when I say I'm a mom to 3 kids, I'm not just saying that because I want you to know I'm a mom and I have experience, but I really truly believe that moms and dads, but specifically moms have that just inner knowing or that intuition that says something's off with our kids. And what you will hear me over the next hour really talk about is the effect that, yes, moms really do know what's going on with their kids. And we don't want to minimize or lessen or silence that little voice inside our heads or that gut reaction that we think something's off here. And I'm going to draw upon my own experiences with that as well. So a little disclaimer before we get going. This webinar is not intended as a diagnosis for any childhood disease or any disease for that case. If you are at all concerned with the health of your child and you feel you need professional advice, please contact a healthcare practitioner. That's what they're there for. This may include medical doctors, naturopaths, chiropractors, nurse practitioners, etc. The purpose of this webinar is to empower parents to understand the basics of some common childhood disorders so that they feel more confident and empowered with their ability to proactively take care of their kids' health. So why do we need to look at natural health options for our kids? These are some of the basics, specifically around antibiotics. Antibiotics are the #1 prescribed medication or prescription for children. 69% of children under the age of 2 are prescribed at least 1 dose of antibiotics. This was a study that was done back looking between the years of 2010 to 2013. I'm sorry, from 2010 until 2013. Of these children, they were given antibiotics 2.3 times before the age of 5. The challenge with this is that the overuse of antibiotics, especially in young children, has led to this spread of metabolic and autoimmune diseases, including asthma, food allergies, eczema, obesity, and type 1 and 2 diabetes. Now, for those of us who are maybe in healthcare or who have done some research, what you're going to see here is that a lot of these all fall under inflammatory disease processes. And this has been something that has fascinated me for years, when my background in nutrition, chiropractic, of course, and then all of the postgraduate work I did, and ongoing research and study and reading that I've done, I'm always fascinated by the effects of inflammation on the human body. So it was really important for me to see the link between the connection with the overuse of antibiotics and all of these different inflammatory conditions. Antibiotics are for bacterial infections only, not viral. And two of the things we're going to talk today about are colds and flu, and recognizing that antibiotics are still prescribed for colds and flu quite frequently. Now, what's interesting is that when they did start to chat with medical doctors, or they polled medical doctors to see why it is that parents, when they go into a medical doctor, they are looking to leave with something. They rarely want to leave hearing, your child will be fine, we just want to take the wait and see approach. And so when we're looking at how much of an impact how much of an impact parents have when it comes to the health of their children, and with regards to swaying medical doctors in terms of how they, what they do, it's very easy for them to prescribe an antibiotic or a script for an antibiotic that can be filled by the parent at that point. So even with things for colds and flus, we're seeing antibiotics prescribed when they're not necessary, right? And what we do now see is that when the overuse of these antibiotics, or the prescription, whether or not it may even be valid, it may be a bacterial infection, but it's not necessarily needed right off the bat, right? Sometimes that wait and see approach for things like ear infections, et cetera, are really important to just take a moment and wait and see into how the child's going to respond, with a lot of more natural options there. Experts estimate that up to 50% of antibiotic prescriptions in the US are unnecessary, whether they are being malprescribed for maybe a viral infection, or again, it just needs to be a wait and see approach. So why is prevention key? Any type of infection or symptom is a sign that the immune system is being compromised, and your immune system is crucial. There are so many components that make up your immune system. It is what kicks into overdrive on the very basic level. It is what kicks in it's always working, let's be clear. Like, your immune system is never not working, but when it's being compromised or tested, that's when we start to see symptoms. And it can be as simple as a runny nose. It could be as simple as some very basic stomach upset or something along those lines, that is telling us that our immune system is being compromised. And to whatever degree it's compromised, this is where we need to focus. What I find interesting is when I see parents, or well, honestly, any marketing guru that is working in for drugs and medications, healthcare practitioners, they will spread a lot of misinformation when it comes to how certain illnesses are spread. Like when we look at the flu or cold viruses or anything, really, when we look at the measles outbreaks and so on, what we're told is that the measles are the culprit, or the virus is the culprit. But ultimately, to me, I think that's only part of the issue here. When we see something like, let's take the cold or flu, because that's a really simple thing to wrap our brains around, or even a cold. If there's a cold virus going around a school, if the cold virus is the thing that makes us sick, then by logic, every single person at that school would be sick, right? Because if the cold virus is the culprit here, then every single person is going to get sick, because they've all been exposed. We all breathe in the same air. So everyone in that school environment would be compromised and they would be sick. But ultimately, we know that's not the case. Usually, like a cold virus or a flu virus, whatever it is going to wipe out a certain percentage of people where they're getting ill. And ultimately, that's because that certain percentage of the population has an immune system that's not being as well supported as the other people. It may be because some of the components we're about to talk to here are not being taken care of, whether the diet is compromised, whether they're not getting enough sleep, whether there's a high amount of stress, whether they're not exercising, whether they're not using preventative self-care and healthcare measures on a daily basis. This is where we start to see challenges. And ultimately, yes, the cold virus is going to, we can all be exposed to the cold virus, but not everyone is going to fall sick to the cold or to the flu or whatever it is. We know that it's ultimately the immune system. When the immune system is compromised, then we're much more likelihood of getting sick and whatever that is. So ultimately, my goal with my kids, with my family, is to bolster the immune system, to keep it strong, keep it well supported all the time, so that we have a much less likelihood of getting ill ourselves. Now, does this mean, based on everything we're about to go through here, that we don't get sick? Absolutely not. There are always times that we have things happen where, you know, we get sick or someone falls ill. My daughter was home today. She had a headache and some stomach pain. She had a fever and so on. And I'll share with you what we did. And but ultimately, I know that we have had a lot of stress personally in our last little bit. We had a funeral for my stepdad just yesterday, visitation 2 days ago. We've had a lot going on. We were away on vacation the week before, but it was a ski vacation, so we were going. You know, there was a lot of difference in sleep patterns. We were having more treats than we normally would when we were on vacation. So there was a lot going on when we look at all of these different components. So in her case, she got sick. Now, what was interesting is that not everyone else in our family did. She was, you know, and not only that, but no one else got sick since she's been sick. So it's just a matter of looking at what was going on with her system that she wasn't able to really she wasn't really able to fight this off. So when we look at prevention, this is what we do on a regular basis, or kind of take keep an eye on with our kids on a regular basis. So as you know, if anyone follows me, you know that I'm a big advocate for doTERRA essential oils. I teach about those regularly. Essential oils on a daily basis, whether you are using them topically, as seen in the photo here with my youngest daughter, whether you are diffusing them or whether you're taking them internally, doTERRA essential oils, and I specify doTERRA simply because I simply don't trust other essential oil companies to the same degree that I trust doTERRA. Essential oils can be used for a variety of different things: emotional support, physical support, etc. But one of the things I love about them is that they really do help with regards to the immune system. And essential oils that are high on the ORAC scale, which is the oxygen radical absorbance capacity value, which is basically any plant. So essential oils are plants, plant material that have been taken from the actual plant and brought down to the point where they're just in an oil form through a variety of different processes. And when they are high on that ORAC scale, that's to what degree we have the ability to have antioxidants in it. And antioxidants are really great for free radicals and taking care of the damage of free radicals. So essential oils on the daily, ones that have high ORAC, which are going to increase with your antioxidants, which are going to support a great immune system, are things like clove, turmeric, oregano, which I spelled incorrectly there, of course, and cinnamon. So those oils are ones that I use regularly with my kids. Oregano oil is not one that I use on the daily basis, but certainly if they are fighting a major infection, I'll bring that in. But clove, turmeric, and cinnamon are oils that I do use on a daily basis, either individually or with a blend called On Guard, which is an immune support blend with doTERRA. Vitamin D daily. Vitamin D comes naturally through the sun. It actually, the rays from the sun mix with the cholesterol in your skin, and it produces vitamin D in your system, which is amazing. Now, the challenge with this is that, one, I live in Canada, and we don't get nearly enough sun for 6 months of the year, if not longer. And in the months of the year that we do have sun, often people, not ourselves, we choose not to use sunblock, but for those people that do, they are slathering up, and so they're not able to get as much vitamin D as needed. So we use vitamin D drops on a regular basis. Children and adults need 35 IU, or international units, of vitamin D per pound of body weight. Ultimately, minimum 2,000 for children, upwards of 5,000 for adults, and that can even increase higher if you are fighting infections on a regular basis. We want to look at, when it comes to nutrition, decreasing the ingestion of sugar, keeping in mind with sugar, grains, if we are very high in grains break down to sugars as well. So a lot of people will tell me that they're not sugarholics. However, they do eat a lot of grains, right? We have breads for sugar, for breakfast, and maybe pasta or a sandwich for lunch. And then at dinner, we're having rice or pasta again. And these grains over time really do increase. So I don't mind a little bit of grains by any stretch, but I think that in general, our society tends to use the overuse of grains, and we need to watch that because they break down to sugar, just as sugars, of course, are bad for us as well. Increase, however, the ingestion of quality grass-fed proteins and dairy, fermented foods, quality fats, vegetables, fruits, etc. So looking at a really good nutritional basis, I could talk for hours on nutrition. I absolutely love that topic. That's not the point for tonight, but by all means, start researching up on that for yourself and recognizing how key diet is, especially when it comes to inflammatory conditions, which we talked about briefly. Regular exercise is really important. Not only does it decrease or helps us deal with, it doesn't decrease our stress levels, but it helps us deal with stress more appropriately. But it's just great for our cardiovascular system and our nervous system, everything, our skeletal system, our muscular system. So our nervous system, I think I mentioned, regular exercise is crucial. Finding something you love and doing it often, making sure your kids are getting involved. I say this now with my kids being distracted in the other room with the TV because I'm on this doing this webinar right now, but making sure that they're getting out and being active is really critical, and not having them become couch surfers with video games and iPads and technology, etc. And then quality sleep is the last thing. Quality sleep, I think, is one that gets just a real sort of pushed to the side. Not as many people worry about that, and it is so critical to make sure that our kids are getting quality sleep. When we are, quantity is important too, but the quality is what I really harp on with when I used to work with patients and when I'm working with people now with doTERRA, because if we're having sleep that's disrupted on a regular basis, if we aren't resting well, if we are restless, then that's going to have an impact on how well our body heals throughout the evening. And when we sleep at night, it's our body's ability to quiet certain systems in our body that allows for other systems like our healing systems to kick in, our immune systems, etc., and basically clean up whatever damage we've done throughout the day. It's when our body repairs itself. So it's a really good option, or a really good important factor, is to make sure that we're getting lots and lots of sleep. All right, so let's jump in though, however, to the four main ones. And I mentioned ear infections earlier, and I might spitball on ear infections in a bit because I didn't bring that up with regards to one of these slides. But I do want to talk about why actually, let me go back for just a second here. So when we're looking at this, before we even get into fever and stomach issues and colds and flu, I really want to address the fact that what I talked about earlier is that mom's intuition. And the reason I think this is so key is that we have been taught, and it has been drilled into us to trust medical doctors, trust medical professions, because they are going to be the experts when it comes to health. And I'm not taking any. We have some incredible people in our family that are in the medical profession, and they do wonderful jobs, and they are amazing people, and they are to be trusted. However, I would note that they are there for the treatment of disease, not for the building or the strengthening of health. You wouldn't go to a medical doctor or a health clinic or a walk-in clinic or a hospital and ask them, what can I do to get healthier, right? Because they're there to ensure that when stuff is going really badly, when we need them, that's what they're there for. And they do an incredible job of that. Let me pull upon our own personal experience. My son, about 2.5 years ago, had a lot of health issues going on, really scary health issues going on, where he was getting a lot of vomiting, a lot of pain in his stomach, and we really weren't sure what was happening. And we were able to tap into our medical doctors and an incredible children's hospital near to us, and they really took care and figured out what was going on. And in an emergency situation, it was needed, and thank God they were there. But the emergency stuff is what they handled. The follow-up, when it came to how do we really build health, how do we support him going forward, how do we need to look at his nutrition to support this going forward, how do we need to look at his neurological health going forward. As a chiropractor, I was very excited about that. And ultimately, we needed to make the decision there to decide what was going to be the best course of action, and we needed to bring in other people in order to make and build up his strength and his health later. So when it comes to the emergency doctors, absolutely, and the healthcare practitioners that are there when kids are sick, it is critical to be able to talk to them and get their experience and know what they need to do. But when it comes to strengthening health and being there and just sort of tapping into that intuition that says, I know what my kid looks like when they're normal, or when they're fighting an infection that really isn't an emergency, that when it does flip over to an emergency situation where things are going downhill and I know I need someone beyond certainly my capabilities as a mother or your capabilities as a parent, that's when we really need to tap into the healthcare practitioners that are there for the big time issues. And I think what I really hope from this presentation is that you're going to be able to take away at this point what works well, what you can sort of, again, tap into what you know is okay. And then when it does start to waver over to, no, this is getting beyond what I'm capable of, this is what I really need to go to and help with. But we're not jumping to needing those emergency medical practitioners way too early in that whole process. Because I think what has been taken away from us is that the fear has been driven into people that as soon as we see a fever, as soon as we see a child throwing up, as soon as they get a really bad headache, we go into that fear mode that says, oh my gosh, something has to be awful. Something really has to be wrong. And we're driving in droves into the emergency clinics and the emergency rooms and so on. And they are overrun and not able to really focus on the true emergencies. And so this is what I'm hoping that you guys will get from this presentation, is to be able to really sort of sit back, reflect, and say, is this a true emergency, or can I support the health of my child and let them go through whatever it is that they need to go through? So let's start here. Before we even get into what to do with fever, a few things to consider. What is the purpose of a fever? Fevers I welcome. My daughter had a fever today. She's 12 years old. And even though, you know, I'm keeping an eye on it, I'm aware of where her temperature is at, I'm not getting freaked out about it, because here's what I noticed is that throughout the day, when someone has a fever, whether it's in the evening, morning, noon, night, I don't care when it is, when there's a fever, it's there for a specific reason. A fever is there to raise your internal body temperature so that it's killing off whatever the infection is on the inside. Whether it's a bacteria, whether it's a virus, whether it's a parasite, whatever it is, that fever is going to increase, or your temperature, excuse me, is going to increase to the point where it is a fever, so that we, as parents, sorry, not as parents, but sorry, so that the body can fight off whatever the infection is. Now, what has been driven into parents is that as soon as we see that number rise, parents are told, oh, well, this is where we need to have a baby Tylenol, or this is where we need to take a fever-reducing medication. But ultimately, what we are doing is stopping the natural response of the body to fight off whatever the infection is. So there's an infection brewing, everything's going on there, and it's percolating away, and it's starting to grow. And as it grows, the body kicks in, the immune system says, whoa, 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 I don't like this. And it starts to increase the body temperature to kill off the infection. So what do? We take a fever-reducing medication, whether it be baby Tylenol, whatever it is, and it drops the fever because we don't like it when our kid feels uncomfortable, which I get that. I totally understand. Watching my kid be miserable today was the hardest part of the whole day. But at least I could sit back and say, okay, she's got a fever, it's brewing, it's allowing her to fight off whatever this is, and I'm just going to keep an eye on her and make sure that she continues to be okay. So ultimately, that fever is there for a reason. And if we try to medicate it to take the fever away, it disallows, it's a disservice to the body, because it doesn't allow the body to continue to do what it's designed to do, which is keep us healthy, keep us alive, because it allows us, it basically stops the body from doing what it's naturally designed to do. So purpose of a fever is there for a good reason. Now, when I say it's not always about the number, people get freaked out when they see a fever, and it starts to increase and increase and increase, whether you're looking at Fahrenheit or Celsius. Ultimately, that should say 48.8, not 28.8. I'm not really sure what happened there. But anyways, when we start to see a fever going, or 38.8, sorry. So it says, if your child is under 3 months old and has a fever, please consult a healthcare practitioner immediately. Or if the fever is, if your child is over 36 months and it's over 38.8, not 28.8, that should be a typo there, or 102.2 if you're looking at Fahrenheit. So just to make sure that people are reading that properly. So if the number is increasing, it's not about the number all the time. Now, if it gets to a point where your child is under 3 months old and they have a fever, that's a healthcare practitioner immediately. That's not something we want to mess around with. If they are between 3 months and 36 months and it starts to go over 102.2 or 38.8, well, at that point, yes, we do want to consult a healthcare practitioner. However, if you have a fever that's going up, but it's not necessarily an emergency situation. My daughter's fever got pretty good today, and she was burning up, and it was okay because her body was fighting it. But what was interesting is that the next point here is that if your child has a fever that is stalled for more than 24 hours, so if you see that 38.8 there on the thermometer, if it was stalled there and it wasn't budging, it was 38.8 and no change whatsoever, that would raise a red flag in my head to say, okay, now, I want to get Kaylee into a healthcare practitioner. But her fever would go up for a couple of hours, and then it would decrease for a few hours, and then it would go up a little bit and then it'd go down. And she would have these spikes going up and down and up and down. So it wasn't stalling at any number. So when I say it's not about the number, what I mean is that we don't need to fixate on the number, but instead watch the child. It's very rare that fevers will raise above 40 to 40.5 or 104 to 105 degrees. And if that is the case, yes, you would want to consult a medical doctor at that point or go into a healthcare establishment. Or if your child has a seizure related to a fever spike called a febrile seizure, it's good to see them, good to have them see an MD after the seizure. Seizures will usually only last a couple of, 2 to 5 minutes at the most. And certainly you want to make sure you take care of them at that point, roll them on their side, make sure that they do not have anything in their mouth that they could possibly choke on, keep an eye on them, certainly don't leave them, but ultimately raise their feet a little bit to help, calm everything down. And after that, you want to make sure that you make an appointment with the medical practitioner just to make sure that nothing else is causing that. But often fevers are normal, or febrile seizures are quite normal. But when I say normal, it's only usually about 7 to 10% of the population that will have them up until anywhere between the ages of 2 and 5. And then after about the age of 5, they start to decrease and you don't see them anymore. But they're not an emergency situation, right? It is the first time where we want to make sure that we know what is causing it, but it's not something that we need to panic about each and every single time if your child is prone to febrile seizures. Now, when I say it's not always about the number, the reason I say that is because I'm more concerned about how the child is acting or responding to their fever. So what do I mean by this? If I've seen in my years as a chiropractor, I would see kids with very high fevers that would not alarm me because they were coming in to get adjusted, they were drinking, they were urinating on a regular basis, they were cuddling, they were making eye contact, they were watching a movie at home or playing a game or resting with mom and dad on the couch, sleeping normally, et cetera, et cetera. So they were still acting like themselves, a sick version of themselves, but certainly still acting themselves. I've seen low-grade fevers where a child is not responsive, not completely unresponsive, but, not really making eye contact, completely listless, difficulty rousing after a nap, not urinating, not drinking, taking on liquids nearly enough. Those are the kids that concern me more, even though their fevers might be lower compared to the fevers that are higher when a child's, again, a sick version of themselves. So you just don't want to get caught up in the number so much as more as how your child is responding to you as a parent when they're sick. And I hope that makes sense. But as I mentioned at the end, if we have any questions, I can certainly answer them there. So what do we want to do when our kids have a fever? This is what we did today. Keep monitoring. I kept monitoring my child for changes in her behavior at this point, or function. I made sure that she was well hydrated with water and chicken broth. We kept her warm with layers that could be removed or added on as necessary. So we had a couple of different blankets. If she was chilled, we'd put them on. If she was warm, we'd take them off. I'd let her rest. We did not read stories together. She's 12. She's pretty capable of that. And she didn't want to read a story. Every once in a while, she wanted to watch a movie, and we would put a movie on, but then she'd say her head would hurt. We'd turn it off, and she would rest on the couch while I did some work beside her. Younger kids may want to play a quiet game with you, or they may just want to hear a story from you or something along those lines. You can use essential oils like lavender and peppermint. Both are really great to help them rest. Peppermint, not so much to rest, but it will help them feel cooler. Lavender is lovely as well. It's a great oil to help them rest and make them feel cooler on the inside. But here's the beauty with these is that they will not reduce a fever. Right? The body will respond to essential oils beautifully. I love essential oils for that reason. And both of those oils are safe for children if used responsibly. If you have questions about oils and how to use them, by all means, please reach out to me. That's not the purpose of this talk. So I don't want to go into great details with them, but those oils are really supportive of the immune system. with regards to fever. Stay away from things like dairy, grains, and sugar. They're highly congestive. They are going to slow the immune system's response, and just really ultimately we don't want to do that at this point. We want to let the body do what it needs to do. So we don't need a lot of heavy foods when we're fighting off an infection. Ultimately, keep simple foods going, and we'll just focus on making sure they're well hydrated more than anything. You'll notice that when kids, of course, any parent will know this, is that when they're feeling well, not feeling well, they don't want to eat. Honor that. Don't force the food on them. Don't force liquids on them. Have them drink liquids when they're wanting them. But ultimately, just sort of keep an eye on it and making sure that they are staying hydrated. If you're concerned that they're not hydrated, a few things to look for is dryness around the lips. The skin will, if you pinch it together, it will stay in a pinched position when you let go versus it just coming back to normal. That's usually a good indication of dehydration. But also the big one that I look for is urinating. If kids aren't literally peeing at least every 6 to 8 hours, then at the very least, then that's a concern where we want to get them checked for hydration, and you might need a medical care practitioner at that point. Chiropractic adjustments. As a chiropractor, we make sure that our kids are well adjusted. Nervous system is what chiropractors deal with. Most people think of us as pain doctors. That's not what we do at all. Yes, chiropractic can help with discomfort, but most importantly, with chiropractic, we want to make sure that there's no pressure on the nervous system. The spine is what controls and coordinates, the nervous system is what controls and coordinates all body functions, and the spine is what protects the nervous system. So when my kids are feeling ill, or if anyone's feeling ill, one of the things I'll suggest is that they do get adjusted. Get them into a family chiropractor so that they can make sure and ensure that their nervous systems are functioning at 100% and that they continue to function well. Last but not least, a 24-hour rule. So Kaylee was feeling sick sort of all day. She went to bed still with a mild fever. Tomorrow, it's a PA day for us, but she would be staying home regardless, and she'll be staying home throughout the day. So no activities. I keep that 24-hour rule because fevers can disappear, and then we think, oh gosh, they're doing better. And what do we do? As parents, we want to get them back into regular routine. I get that. Trust me, when I have a kid sick at home, my productivity plummets, right? I don't have as much ability to do as much whatever I need to do, but I still need to make sure that my kids' health is the number one priority. What'll happen is that when we put them back into a school situation or we put them back into activities, then unfortunately what happens is that kids' fevers will, if they've disappeared for a few hours, they will tend to come back with a vengeance. So I always have that 24-hour rule that until that fever has been gone for at least 24 hours, I keep my kids out of activities, school, et cetera, et cetera. The American Academy of Pediatrics. So in case you're thinking, oh gosh, well here's, Dr. Andrea, she's a chiropractor, essential oils lady. I realize I'm a more natural healthcare practitioner. However, the American Academy of Pediatrics backs me up with this. They recognize that fever is not a disease or part of a disease process. Fever is not an illness, rather it is a symptom of sickness and is usually a positive sign that the body is fighting an infection. Fevers generally do not need to be treated with medication unless your child is uncomfortable or has a history of febrile convulsions. The fever may be important in helping your child fight the infection. Even higher temperatures are not in themselves dangerous or significant unless your child has a history of seizures or a chronic disease. Even if your child has a history of fever-related convulsion and you treat the fever with medication, they may still have this kind of seizure. If he is eating and sleeping well and has periods of playfulness, he does not need any treatment. So this is not uncommon. This is a really good point to make, is that fever is a natural process. It is a natural, it's a very good positive finding to say that your child's body is responding appropriately. Thank goodness it's there, right? Because if you think about it, on the other side, let's say there was an infection and your child's body was not kicking in with a fever, that infection is just going to go run rampant and they're going to get much sick much more quicker. So it is a good response when we see a fever. Why treating a fever isn't necessarily a good option. A couple of statistics. These are all some different studies. A study of adults with colds found that aspirin and acetaminophen suppressed production of antibodies and increased the cold symptoms with a trend towards longer infectiousness. In a study of children with chickenpox, acetaminophen prolonged itching and the time to scabbing compared to placebo treatment. In test tube studies, therapeutic levels of aspirin suppressed the ability of human white blood cells to destroy bacteria. And another study found that a host of pain relievers, including aspirin and ibuprofen, inhibited white cell production of antibodies by up to 50%. So don't fear the fever. It's there for a reason. keep an eye on it. Recognize that if things are getting out of control, or if there is, or, you know, if you're feeling, if that gut is saying that there's something more than just a fever, then that's where you want to seek the advice of a healthcare practitioner. But wait and see what happens, see how your child responds to things, and get those natural healthcare options that you have in your home, like essential oils, like something as simple as chicken soup, or vitamin D, and making sure that we simply have a vitamin D should actually be more of a preventative option. It's not a, oh my goodness, my kid is sick, let's take vitamin D, it's going to help them. I mean, it will, but it really builds up in the system over time. Whereas essential oils are sort of one of those things that you can use right away and really start to see an effect on how they're doing. Okay, colds and flu. These are viral conditions, and this is why it's so important to not use antibiotics when we have our cold and flu, because they don't do anything. And the same goes with all these antibacterial soaps and hand gels, or whatever you call them. So those don't help against colds and flu season. So when we see those antibacterial sprays and so on right around this time, I just sort of giggle, because they do nothing to prevent the spread of cold and flu. So colds will last, to determine between the two, colds will last 3 to 4 days. Runny, stuffy nose, sore throat, cough, congestion, mild body aches, mild headache, sneezing, low-grade fever, and general malaise. A flu will last 3 to 4 days with severe symptoms, but up to 2 weeks of lingering symptoms. Much higher fever, rapid onset of symptoms, usually within 3 to 4 hours, non-productive cough, moderate to severe aches and pains, chills, headache, chest discomfort, moderate to severe fatigue. So there is quite a difference between the two. Colds, best to be home to recuperate. Create a peaceful environment for your child. Again, it could be sort of a darkened room. Let them just sort of do their thing, keep them hydrated. Be mindful of the fevers before, although you're not going to see as much of a fever when it comes to a cold. You just sort of want to make sure that they're getting better. Sore throat, as long as they're over the age of 1, I love a little combination of elderberry syrup and or manuka honey. And the reason I love this is that it's so soothing on the sore throat. My son had a really bad cough over Christmas time. It was lasting and kind of just dragging on. No other symptoms, just this cranky cough that he had. And we just did a combination of the syrup and the manuka honey. And honest to God, within 24 hours, it was like a game changer. So it's always good just to have those. We keep them in our fridge for those emergency situations. If they have ear pain, a mixture of tea tree oil and basil essential oil, diluted and down the outside of the ear or neck. So if you tip your head to one side and just under your earlobe, if you kind of palpate down, you're going to feel like a ropey muscle that goes from just below your ear all the way down, kind of right in front of your clavicle or your collarbone. And as you go down, if you were to just move tea tree oil and basil oil down that area with ear pain, those are great ways to help reducing whatever discomfort the kids may have with regards to that. That kind of also plays into ear infections. What I would also offer with ear infections is that we use diluted oregano oil around the area and then also on the bottoms of the feet. On Guard is an essential oil blend from doTERRA, and it's an immune support blend. It has cloves, cinnamon, wild orange, eucalyptus, and rosemary in it. I diffuse this regularly. I had it going all day, and then I diluted it on her feet and back as well with Kaylee, just because we weren't sure what was going on with her infection there. Flu. All right, so same as a cold, but it's going to last a lot longer. 1 to 2 drops of hydrogen peroxide with a 3% dilution. I know what we say, we don't ever put things into an ear, but ultimately when we want to look at this, just 1 to 2 drops is all it's going to take. A 3% dilution when there are symptoms of a flu present is amazing. You'll hear some gurgling with it when you put them in there. That's quite normal. Maybe some crackling or so on, or the child will hear that. But it does do a lot for regards to helping with discomfort and symptoms there. Use of essential oils consistently. Less is more, but more often. So I don't like using a ton of oils at one time with kids, but I use them quite frequently. That being said, the book Symphony of the Cells by Boyd Truman is absolutely amazing. If anyone's interested in that, I just bulk ordered a bunch of them. Please, by all means, if you're local to me and would like to order one, let me know and I'll happily grab one for you. It's a phenomenal book, but you can also find it online with symphonyofthecells.com. Also, the wet sock treatment. Now, this is going to sound really hokey, but I want you to bear with me here. Try it the next time. And if you're worried about your kids, wait for you. Not that I want you to have a flu, but the next time you have a cold or flu, definitely worth trying. So you are going to soak your feet in hot water for 3 minutes. Now you want this water to be as hot as humanly, like that you can handle, right? So super, super hot water for 3 minutes. And then at the same time, you're going to wet one pair of thin cotton socks in cold water, as cold as you can handle, wring them out, and then place on the feet. Then you're going to follow up with heavy wool socks and pull those over the cold socks. Now, you're probably going to think, gosh, this is going to be uncomfortable, but I want you to go to bed and do not remove the socks until they are dry. So overnight, they're going to dry, and in the morning, it's amazing. And this is an old homeopathic, naturopathic treatment, and some people poo-poo it, but I'll tell you, I have used this myself, and it works wonders for the reduction of symptoms and really helping your body process through it. All right, upset stomach. What is the purpose of vomiting and or diarrhea? So let's look at this. That's a thought that, right? Here we are talking about what the benefits of vomiting or diarrhea are. It's there for a reason. If there is something going on in your system, you want to get it out. And the easiest way for your body to get it out is either to throw it up or pass it through the other end. And so vomiting and diarrhea does have a purpose, as irritating and as uncomfortable, and there's nothing worse for me than throwing up. I really dislike it, and I will, in my head, I just think, oh gosh, I don't want to throw up. But as soon as you do throw up, it just does feel so much better, because we're helping to get rid of whatever we need to get rid of. So the causes of this tend to be either viral infection, bacterial infection, a parasite, allergy, lactose intolerance, heavy use of sweetened drinks, which we do have to be mindful of. Also for young children, teething can be a cause of diarrhea specifically. Recognizing that by stopping either of these, what would be the effect, right? Then we've just got whatever it is hanging out inside our system, which is not going to do us well. So things to think about. We need to stay hydrated with both, again, water and broths. Do not give sweetened drinks. We see a lot of those being marketed for upset stomach and diarrhea. Ultimately, this is not the option. Sweetened drinks with the sugar, it's only going to increase whatever the issue is, whether it be the vomiting or diarrhea. So stay away from sugar. Easy foods if the child is interested. Things like broth, rice, applesauce, dry toast. Those are really easy to digest. And it's a really simple thing to get them in. And again, with this, we don't want to force foods on kids. Sometimes we think, oh gosh, they got to eat to bring up their energy stores. Kids are smart. Their bodies are so intuitive. And I think that as parents, we need to recognize what our kids want, what they don't want. Hydration, I'm all over. I don't want my kids getting dehydrated, but if they're not hungry, I'm not going to force food on them. I have always spoken to, as soon as my kids were old enough to understand, I've explained the goodness that is when they're sick. So I explain what a fever is. I explain what throwing up is. I explain when they're having bowel movements that are uncomfortable. I talk to them about what that means so that they understand the purpose of it, so that they can at least at some level feel a little bit more, feel a bit better about what's going on in their system. And I think an empowered child is just as important as an empowered adult. So keep that in mind as well. Peppermint essential oil or Zen Jest, another doTERRA brand oil blend, on their belly and the bottoms of their feet every couple of hours is crucial here. With this also, probiotics is beautiful. And with probiotics, what's interesting is that remember at the beginning of this, we talked a lot about antibiotics being so overly prescribed. Probiotics are key. And I personally take a probiotic every single day. I did have to take a round of antibiotics last November. I had been down to Guatemala, picked up something, gosh only knows, some bacterial infection. And had to be on a pretty good dose of antibiotics, excuse me. So here's what we know about probiotics, and this is a really scary statistic, is that for every course of antibiotics, it requires a minimum of 18 months of daily probiotics to bring the natural good gut bacteria back up to normal. So I'm going to repeat that again. For every course of antibiotics, it takes minimum 18 months up to 2 years of daily probiotic use to bring good gut bacteria back up to normal. Because what happens is that when we take a course of antibiotics, yes, it may be necessary in some cases. In my case, trust me, if you knew my symptoms, it was definitely, it was necessary. I tried to take care of it on my own for the first little bit, and then decided that no, we were going to need to up this up just a touch. So we did the antibiotic route. But when we take antibiotics, it wipes out the bad bacteria, thank goodness, but it also wipes out all of the good bacteria as well. So the daily use of probiotics is going to be critical. When I hear people say, well, I get my probiotics from my yogurt. You're not getting enough of probiotics from your yogurt. You need a really good, high quality, high concentration of probiotic. Shocking, I use doTERRA, of course, and I use their probiotic, and my kids use the PB Assist, which is the probiotic for kids. It's in like a little pixie stick form, and it's absolutely delicious. Truth be told, I sometimes take it as well because it's that delicious on a daily basis. So if you or your child has had antibiotics, it's really critical to make sure that you're getting good probiotics to bring your stomach back up to place. All right, diarrhea, when to call a doctor. If the stool becomes tarry or black, if there have been 8+ stools or bowel movements of diarrhea within 8 hours, if there are signs of dehydration, sunken eyes, the pinching or peeking of the skin, dry mouth and lips, inability to urinate, etc., or in combo with vomiting regularly. So if we're talking diarrhea, vomiting, those are the concerns, and that's what raised our concerns with Blake about 2.5 years ago now. Vomiting, when to call a doctor. If it's either red or green, those are either bile, a lot of bile, and or blood can be an issue. If there's projectile vomiting in infants, if there's severe stomach pain, especially with a fever, as this could indicate appendicitis, or after an injury to a head, because if there's been a head injury, vomiting can indicate that there might be something going on there with a severe concussion. So you want to make sure that you get that checked as well. All right, let's do a recap here before we finish up. How are we doing here? Good on time. Okay, listen to your instincts. Please listen to your instincts. When we go back over how, if my kids are fighting something, the first thing I'm going to do is just watch them, and I'm going to make sure that they're doing okay, and we're going to keep an eye on them. But that gut, when that gut says there's something off here, when I go back to what was going on with Blake, we needed to go through to 3 different medical doctors before someone would listen to me to saying, they kept saying, it's just the flu, it's just the flu. And I knew it wasn't the flu. I knew something bigger was going on. And it took me pushing and pushing and pushing through a medical doctor, through a pediatrician, and finally down to a doctor at Sick Kids, where they took the blood and said, nope, this is severe. We need to get this handled. And sometimes you need to be the biggest advocate for your child. And I cannot stress that enough for parents. But listen to your instincts at the same time and recognize that we don't want to jump to the medicated route if it's not necessary. And that is not, it has to be a joint decision, for you, yourself as the parent, of course, and then also in talking to healthcare practitioners. I talk about that in just a second here. So prevention and strengthening their immune system from the start is key. We went through those tips at the very beginning. Using the tools in your home health care toolbox first. I am the biggest advocate for having tools around your house that you can use, right? I know we have essential oils at our fingertips. If you could see my office right now, you would see them in the back corner. We have them everywhere, and that is the first thing that we will go to first and foremost. It's always the first step, and then from there, if we need to go a medicated route, we will. I'm not afraid to do that, but I'm absolutely going to take care of my kids first and foremost at home. And with regards to that, proper education is key. I don't want you just going out and picking out an essential oil off the shelf at a healthcare store, and if you don't know how to properly use it. One of the perks of working with a doTERRA representative, whether it's myself or someone else, is that we are trained to teach you how to use these oils, when to use them, how to use them safely and effectively, and when to use them smartly. Because the overuse of anything is inappropriate, and at the same time, we also want to give you the tools so that you feel empowered, so that if something does hit at 2 in the morning, you can help your child through the night and then reassess in the morning whether or not you need to take them to the medical doctor or go to the emergency room or something along those lines. But I love, love, love having something that I can use at home first and foremost. Recognizing the red flags that legitimately are a health concern that need attention from a healthcare provider, regardless of who that healthcare provider is. It doesn't always necessarily need to be a medical doctor or the emergency room. It could be any healthcare practitioner trained because they know what they need to look for, and they will be the ones to refer out if need be. Lastly, surround yourself with a healthcare team that is supportive of your values and beliefs when it comes to your healthcare choices. And if you don't have one yet, create one. Whatever relationship you have right now with your healthcare practitioners does not mean it is the healthcare team that you have to use going forward. I think so many parents over time get frustrated with that, and we recognize that there are so many options out there, and ultimately we just need to, you just want to be able to have someone that believes in you, that supports you and your decisions, and doesn't make you feel uncomfortable with whatever decisions you're making. So finding that healthcare team, that can be a great medical doctor, it can be a chiropractor, a osteopath, a massage therapist, a naturopath, whomever, whatever it is that makes sense for you, physiotherapist, whatever, but getting a healthcare team that you can go to for different advice depending on what it is that you need and when you need it. All right, thank you so much for joining me tonight. I very, very much appreciate it. For anyone that does have questions, you can check out my website at DrAndreaRyan.com, or find me on Instagram, Facebook, anything along those lines, always using the Dr. Andrea Ryan component. I appreciate you guys joining me here tonight. Thank you.